Believe me, I have never seen a symptom become so popular. Who would have ever thought that something so small could become an alarm sign for most of the human population? The loss of taste and smell is definitely something you should be worried about, especially now with everything that's going on. Now you have to be careful because the loss of taste and smell is not only a sign of the infection, we know what we're talking about, but it can also be a sign of many other important health conditions that you need to know about to recognize the difference if it ever happens to you. So in today's video, I'm going to reveal 7 of the most common health conditions that express themselves with the loss of taste and smell, and how to treat them naturally and effectively. Hey guys, Dr. Gus here, naturopath, acupuncturist, conventional doctor, and founder of drlandivar.com. In this channel, as a conventional doctor, treat my patients through natural medicine before recurring to the use of pharmaceutical drugs. So if you're new to my channel, consider subscribing and press that bell down below to see notifications and be the first one to watch a new video. If you need to line an appointment with quality supplements for your disease, visit drlandivar.com and stay till the end of this video where I'm going to share extra tips and video links related to this topic. When your sense of smell goes south, taste usually follows. This happens because there's an olfactory area in your nose that controls both senses. You see, when you eat and chew your food, odor molecules enter the back of your nose and your taste buds tell you if that food is sweet, sour, bitter, or salty. Your nose figures out the specifics and it tells you if you're eating an apple or a grape. Now, if you plug up your nose, food will never taste the same simply because you're incapable of smelling it. So in today's video, I'm going to reveal 7 of the most common health conditions that express themselves with the loss of taste and smell, and how you can treat them naturally and effectively. Number 1, age. Age is the first cause of illness in the human body, and we tend to forget this. If you think about it, we have the extraordinary ability to preserve its function to the very last minute of our lives. Something that has always impressed the scientific community is how we have the power to stay well functioning for more than 60, 70, 80, or even 90 years. We have the ability to stay healthy and strong for a much longer time than any other machine ever created, and sometimes without help. Now, nonetheless, age obviously tends to carry its consequences. We tend to lose some of those olfactory nerve fibers in our nose, and our taste buds lose the ability to stay as sharp as they should be. This obviously affects our ability to notice those differences in salty and sweet tastes, leaving you with that unpleasant experience of not being able to smell or taste correctly. So age is number 1. Number 2, the infection. When I mention the infection, you probably know what I'm referring to. It's that health condition we are all facing today and that I can't mention on YouTube. Unfortunately, I can't mention its name without being censored, so we'll leave it at that. You see, anything that irritates or inflames the inner lining of your nose and makes it feel stuffy, runny, itchy, or drippy can affect your senses of smell and taste. This, for example, includes a common cold, a sinus infection, allergies, sneezing, congestion, or the flu. Now, we obviously haven't seen anything as aggressive as this we're living today. No other infection has been seen to eliminate taste or smell entirely and so aggressively, not the way we're seeing it. Now, this is a reason why most doctors now are recognizing this health condition as one of the most aggressive with respects to smell and taste. No other condition has been seen to cause it so aggressively and so rapidly and takes so long to disappear. Now, you have to be careful because this symptom needs to be analyzed very well before jumping into a conclusion. In many occasions, you might be suffering from other causes and other infections that have nothing to do with the infection we are talking about. Number 3, vitamin deficiencies. If you ever lose your taste and smell, this could be one of the body's ways of telling you that you are low on certain vitamins. This could be the result of a bad diet, or maybe simply something you didn't realize that was happening. It's also common to see that certain conditions can cause you to be low on certain vitamins and are associated with the loss of taste and smell. Some of these can be vitamin A, vitamin B6, vitamin B12, maybe zinc. In some cases, it can also happen when you are a vegetarian and you're not taking good care of the nutrition you should be taking. A lack of meats, for example, including chicken, eggs, any of these contribute to a low concentration of these specific vitamins. So be careful. Any vitamin deficiency has its consequences, even if you are not feeling them. If you need a good quality multivitamin formula that contains every vitamin and mineral your body needs to function, but on top of that comes along with 42 different fruit and vegetable extracts for better effect in action, look for multivitamin from Finland at drlandivar.com. Multivitamin is the most complete formula of vitamins and minerals and foods available. Number 4, medications. I don't know if you've ever experienced a change in smell and taste after taking certain medications. Some prescriptions and over-the-counter medications can shift your senses, making you change your perception of foods. This happens specifically, for example, with antibiotics and blood pressure medications. They can either alter your taste receptors or end up scrambling the messages that you need to receive in your system in order to recognize certain tastes and smells. I've seen it happen with antiparasitic drugs, for example. They can change your saliva or maybe the taste of your food completely, so be very careful. If this is happening to you, you need to talk to your doctor before stopping any medication that you are needing. There might be some other type of drug that doesn't have that same effect, and he will know about that. Number 5, obstructions. When someone tells you that they've lost their smell and taste, especially today obviously, the last thing you might think about is an obstruction. If you can't get enough air through your nose, you will obviously feel that your smell is changing. As I mentioned before, smell affects the way you are tasting things. Blockages and obstructions may happen, for example, if you have a nasal polyp. Nasal polyps are non-cancerous tumors that grow inside your nose and in the lining of your nose and sinuses. Another very common cause may happen if you have an accident, for example. If you have a deviated septum that makes your nasal passages smaller than the other one you have. If you have any of these conditions or any others causing any blockages, this might happen to you. The loss of taste and smell does not specifically mean you have the infection. Remember that. Number 6, a head injury. I don't know if you've ever experienced or seen someone that loses their taste and smell after a head injury. You see, the olfactory nerve that is in your head carries scent information from your nose to your brain. Obviously, trauma to the head, neck, or brain can damage that nerve, as well as the lining of your nose or nasal passages that carry that smell. People who suffer from these type of accidents may notice it immediately, or over time. It may take some time to appear. In some cases, senses return to normal if you wait or if you do any type of treatment that you need at the moment. Now you have to pay close attention because it should be getting a lot better over time, and if it doesn't, something else might be going on. And help out the channel by giving this a thumbs up and share it with your friends and family. If you have any questions, leave your comments down below and I'll be happy to assist you. If you need quality supplements for your disease or line of appointment, visit drlandivar.com and check out these other videos related to this topic for valid information that might prevent a serious health condition in the future. Thanks for watching, you guys, and I'll see you soon.